Hi, thank you so much for joining me today. Today's video is a listicle type video where I'm gonna offer some practical advice that I hope will be helpful for those of you who are new to being a psychiatric survivor. My name is Amanda and I'm an aspiring health coach. I am looking for ways to help people get off and stay off psychiatric medications, and I'm sharing my own physical and mental health struggles along the way. So recently I had a conversation with my medical doctor that proved me right, and I don't enjoy it as much as I should, I think, being right about these things, because in a previous video I talked about why I felt driven to get a functional medical doctor, because discussing lingering issues of mood and energy regulation with my GP always leads to a discussion about psych meds, and that discussion is usually a battle or a confrontation, and it's one that I can't win as long as the miseducation of the public and of medical professionals by the pharmaceutical industry is as powerful and pervasive as it is. So I chose to become a subscriber of a functional medicine service that provides me with telehealth visits to a doctor and a nutritionist and some others, and is all about functional labs and testing and data. And I chose to do that specifically because I had a feeling that I could approach them with my conundrum, which is that I feel that my energy patterns are not as regular as they should be, but I also seldom reach the level of mania, and it's mostly subclinical, even the periods of low energy. I don't think I would call them depressions anymore. Every 3 to 4 years there will be a true mania or a true depression or both, and then I'm often at a loss, because the argument to me that my medical doctor and others want to make is that I should go back on meds and stay on meds, and if I don't want that to happen, what is the problem? And I think we have a major misunderstanding about psychiatric meds and what they actually do, and it's very frustrating for those of us who have walked away from them, because I've become so siloed in my own social media intake, and I live every day in that silo, but there's a ton of information. There are lectures by Joanna Moncrief, there are books, there are a ton of videos of Robert Whitaker explaining the research that he has done, and in partnership with Peter Goetsch. And just the volume of information decrying these drugs as being unsafe, ineffective, harmful, and the specific information that's come to light about how they got to market, how they continue to be marketed and sold, even in the face of major investigative journalism that shows how the makers of the drugs manipulate the data, cook it up, serve it up to regulators that they have captured, and so on and so forth. And then they ignore actual data about the harmful side effects. So when people in general express sympathy for me as a psychiatric patient, they often repeat cliches that have been debunked, such as, I know that there's such a thing as some people have a chemical imbalance in their brain. They think that these statements are destigmatizing to us, but they're actually based on lies that have been perpetuated by the makers of these drugs. There's no chemical imbalance involved. In fact, the chemical imbalances come from taking the medication. That much they have proven, okay? So there's not an excess of dopamine involved in schizophrenia that they know of, that they're able to prove. That was always a theory. There's not a deficiency of serotonin in depression that they know of, that they're able to prove. But once you stay on mood stabilizers, antidepressants, or antipsychotics for any length of time, there will be deficiencies and imbalances in some key neurotransmitters in your brain caused by the chemicals inside it from the pills. Okay, so how to talk to a doctor without having to spend 6.5 minutes arguing, because you're gonna get, like, even as I present this to you now, I am angered. I am in a state of emotional arousal that I don't need to live here. I don't need to be here every day. So I think about what is it that for me I have the most resentment about as a psychiatric survivor, and it's not actually about the direct harm that has come to me from medication taking, nor is it the gaslighting that I experienced as a psychiatric patient. I think the thing that I still resent the most now is the social isolation and the alienation of knowing what I know, and yet it's still being the minority view. So much so that I think a random sample of 10 Americans, you could sample 50 Americans, and you'd be lucky if you get one or two who actually know the facts about this matter, and it doesn't really rise to the level of awareness that it should. So for me now, I've worked so hard, and I've made another video where I talk about why it was difficult for me to establish a relationship and have rapport with my medical doctor. And I love my medical doctor. As a person, she is warm and caring. She is very competent. She's very knowledgeable, and she's not just there to punch a clock. Sometimes you can get that sort of jaded clinician, but she and I, you know, it wasn't always this easy to talk to her, and there's been a lot of back and forth and us talking over each other, and unfortunately her introduction to me was 2 years ago when I went in seeking meds. So she knows me first as a psych patient, and that was a big mistake on my part. It had been 13, 14 years, and then I went through a bad cycle, and it broke me down enough that I was open to trying medication again, and my experience of the medication just reconfirmed what I'd already. It was just more confirmation that it doesn't help, it doesn't work. So she now knows me as the one who came in a very bad state, and then tried meds, and then just said, no, I'm not going to do this, sorry. So I'm non-compliant, and I'm always really sus. And I've had interactions with her where she's scrutinized me. I think it's just, I always feel defensive, and I was happy that I was going over lab results of a chem panel with her. My chem panel looked great. I was very pleased that it was a very thorough investigation. She and I did talk about functional medicine, and she's interested in it, and she's reading a lot of doctors. She's reading Dr. Mark Hyman. But at one point, I did feel rather baited because, and I'm sure she did not mean to make me feel bad. She's certainly not intentionally. She doesn't have like a malevolence or a demeaning attitude to her. So, but she said, when you came in, you had been working this job, and we talked about how I felt, and I said yes, and I feel like there's a particular set of circumstances regarding that, and I said, those set of circumstances have happened before, and I have gone into mania, and I think it has to do with this, and I started to talk about the specifics, and she stopped me, and she said, I think you're trying to rationalize a sick brain. And then talked more about how my brain was chronically sick. And I had to stop her and say, because she was saying things like, I would just feel better if you would see a psychiatrist. And then she goes, I know you're going to say no. I said, hell no. I'm going to say hell no. No and hell no. That's my answer. And then she said, well, can you go see are you in counseling? And now I'm going to make a whole other video about how nobody in this world can accept that you can go to counseling, get counseled, get better, and then stop. There's no off-ramp. That is one of my biggest issues, is there is no exit ramp, and you're not allowed to stop. And nor are you allowed to question the logic of modalities that you cannot say for sure actually helping you, but you got to argue with everybody about stopping them, because oh no, now you're completely bucking the system. You're not medicated, and you're not talking to a counselor. You're not doing therapy. I'm going to make another whole other video on therapy, okay? Because I used to think that it was, we have some really delusional thinking around psychotherapy. I think it is. I'll make another video. I'm not getting into it right now. But if you choose to stop because you're better, no one is going to believe you. You will never have the credibility that you had as a non-psych patient. It will never grow back. Okay? It's just you have to accept that if your best bet, your best strategy, honestly, for being a former psych patient, for being a psychiatric survivor, is just not to disclose ever to anyone. But in medical circumstances, it's not always possible because these people keep records and it follows you. Okay, so then my point to her really is that I'm tired of being labeled sick when in fact I was injured. And I've raised this point again and again, but if medical doctors want to have an in with somebody like me, timelines matter, questions matter. You might want to ask some questions, is all I'm saying. So what I did discuss with her are some stats that I pulled from Robert Whitaker's now probably outdated book, Anatomy of an Epidemic, but it was sort of like the foundational text for this movement of psychiatric survivors. But I tried to explain to her that what she's calling a sick brain is actually iatrogenic harm. That as far as I'm concerned, my brain, and I didn't explain this much, but my brain was damaged by my abusive family. I was abused, so there's trauma there. That is damage. That is not an illness. I didn't get it through genes gone haywire, okay? It wasn't a destiny. It was something that happened nobody wanted to hold the perpetrators accountable, etc., etc. So first there was that damage. Then in trying to treat that damage, doctors put medications into me that did further damage to my brain. So as an adult, I feel that no one can accept that I could have done years of therapy and actually become resilient to the harms that were done to me as a child. People cannot let you be a survivor and just be okay. You must kind of feed into this narrative that they have of perpetual treatment, and when you do, your role socially is as an invalid, and those are the options. So I encountered this a lot. I had another conversation in which I encountered this problem that I will make another video about. But basically, I was seeking the services of a health coach, and because of these hang-ups that are installed in people's minds about the supremacy of psychiatric diagnoses as a paradigm. Okay, just the blanket acceptance of them and the non-examination of what is really going on here. And what is really going on is the mental health care industrial complex. Okay, so you as a non-user are constantly in a dilemma, because if you talk about your story as a non-user, people will look for ways to discredit you. People will say, well, I know that the psychiatric medications are hard for people to take because of this and that, but therapy, that could really, that's good, and that's not medications, so, but you must you have to be really tough. If you're going to do this, you have to say, okay, I'm really going to have to be tough. People are going to not agree with me, and I'm going to have the conversations that trigger me, and I'm going to have them a lot. And just know that that's your lot in life, and accept it. So one thing about discussing it with people who are not themselves psychiatric patients or survivors is that the line that I would get over and over again, well, I know it's really hard because the medications are very hard because they have a lot of side effects. Well, thank you for that. Thank you so much for using me as an opportunity to virtue signal and show off your goddamn knowledge about stuff that you don't have to deal with. But when people say the side effect thing, they're really talking about 1/3 of the story. First of all, as this woman I really like to follow, Nezeret Bemian, who used to be a psychiatric nurse, likes to say, this term side effect is a bogus term. It's there to mislead you. It's there to frame things in a way that will make you more accepting of the illogic of the pill makers and the pill pushers. So drugs have effects. Some of the effects are desired effects, and they have trained the public and doctors alike to talk about effects that are not the targeted, wanted effects as side effects, when in fact you cannot remove them from the rest of the effects. So with every drug, the things that you think of as side effects are also the full effects, as Nezeret likes to say. Those are the full effects of the drug. And not everyone will have every effect from every drug. So there's no way for you to know. So, the commiseration from people who want to show that they are totally, they're so liberal and progressive and accepting of the mentally ill, and they understand the plight is hard because of the side effects. The side effects are the full effects. Furthermore, the assumption is that, and this is, I believe, this is my doctor's actual attitude. She's a nurse practitioner, but for all intents and purposes, she's my treating GP. So we'll call her the doctor. So the supposition is that people like me refuse to take our medications because the side effects are so bad that we just don't want, and we can't tolerate the drugs. But it's a pity and it's a shame in their eyes, because the drugs will really actually treat the conditions that we have. And so if we could just see ourselves objectively, which we're incapable of doing. First of all, everyone is kind of incapable of that, but we especially, because our conditions are impairing of our own self-judgment about ourselves. Our own judgment is impaired, so we're even less capable than neurotypical people of making good decisions based on realities that we actually experience. So the problem from their perspective is that they haven't got good enough drugs to make us take them. Maybe if they had gentler, better drugs. And that's why they say, oh, this is a first generation, this is a second generation, because they're doing iterations. But basically they're missing the point, which is that for some people, maybe you could say the side effect profiles outweigh the benefits so much that the benefits aren't worth it. But moreover, the more you listen to people and their stories, what psychiatric survivors are actually saying is not that. They're not saying, yes, this drug did this, but I couldn't tolerate because these side effects were worse than and on balance, and I made the calculation. They're saying there's no benefits. That's what they're saying. They're saying they made me take these drugs. They did not tell me that they were going to make me feel this bad or do this, this, and this that is unwanted. And furthermore, I did not experience a reduction in my mental health symptoms. Or if I did, it was short-lived. And then 1 year, 2 years, 3 years down the line, it was, and then the only suggestion was more drugs. And more. So, I mean, what people don't understand is that the drugs don't treat the conditions. And this is what I told my doctor. I said, the drugs do not treat bipolar disorder. The drugs for bipolar disorder do not effectively treat my bipolar disorder. They don't work. So, especially given that they don't work, I'm not going to suborn the side effects. I would consider suborning the side effects if they worked. But the drugs for bipolar don't make me any less bipolar. They make me less manic, but I still have the horrid depression. So it doesn't treat the condition. You can make a person come out of psychosis and stay not psychotic with antipsychotics, but you also make them mentally ill in a whole different new way. And that's called side effect. It's not side effects. It's actual, does it matter at the end of the day if it's in your body, if it's happening to you? Do you care? To whom is it a side effect and why? Who benefits from that language, that sort of, let's put this in a box. It's a tool. It's a linguistic tool. It's a sleight of hand. It's to get you to reframe things. It's to install a way of thinking in your mind. So given all of this, let's talk about ways to cope. You don't want to have this conversation in a doctor's office. You don't want to argue. It will only make you frustrated. It will only make you feel emotional, and then when you express that, it weakens your case even more. So the best things to say in a neutral, stoic way. I've come up with a list. I hope they're helpful. If you think that these are good things to say, let me know in the comments below. Or maybe you have your own. So my doctor encouraged me to see a psychiatrist, and she encouraged me to see a counselor because she would feel better. That's what she said. Because this therapist could monitor me. And that way, if I were going to become manic, they could pick up on it and they could help me, because I won't be able to. I know all this. I'll talk more in another video. But so here's what I think things that I should have said or could have said. Okay. So this is my list of, I should have said that. Okay. Now that I've had 48 hours to reflect on it. The first one is, unfortunately, as your patient, it is not my job to make you feel better. Number 2, thank you for your concern. I can see that you really appreciate the risks to me from being off meds. I wish that you had had enough appreciation for the risks to me of taking the meds in the first place. Number 3, silence. Like they say in some circles, no is a complete sentence. So if you have the personality to stonewall somebody and you're okay with that, okay. Number 4, according to the research of Robert Whitaker, Peter Goetsch, and others, people who take psychiatric medications die 20 to 25 years before the rest of the population. Your suggestion is a violation of the Hippocratic Oath, and I'm sorry. Number 5, I did therapy for years, and you will be glad to know that it worked. 6, thank you for prescribing these meds. They saved my life. Now, in order to prolong it, I must discontinue them or continue to refuse to take them. Number 7, I don't respond well to meds. I've only tried 14 of them, though. Number 8, I prefer to get support from people who don't charge by the hour. Number 9, as a psychiatric patient, I cannot prove to you that these drugs fail to treat my disorder as long as you're taught to frame my refusal to take them as a failure of compliance. I do not owe you compliance. If in my experience compliance is continuous self-harm, I do not owe you compliance. Number 10, I'm still dealing with the brain damage from the last time I followed the orders of a psychiatrist, so I'm gonna wait until I'm not dealing with that, and then I'll let you know. Number 11, maybe my mental and emotional health is beyond the scope of your practice or anyone's medical practice at this time, and that is okay with me. But thank you. I'm trying to keep it polite. Some of them I'm not, and some of them I'm really trying to keep it polite. Number 12, I'm sorry. I wish I could make more sense to you. I recommend that if you want to learn more about the basis for my choice, that you read thus and such. So, like, for example, with me, that would be Robert Whitaker's Anatomy of an Epidemic, and James Davies' Sedated, and Dr. Jessica Taylor's Sexy but Psycho. Also Peter Goch's Mental Health Survival Kit, and Sam Tamimi's Insane Medicine, for example. These are all books that I have read, and I highly recommend them. Okay, so that's my suggestion for you today. I hope this was helpful. Let me know. Thank you very much for listening. I'm Amanda. I live in the United States, and hopefully sometime within the next few years, I will be a certified health coach.